Assalamualaikum and hello doctors and my fellow friend. I am Ahmad Yasin bin Syafruddin from medical student U1, and today I'm gonna present about heart and cardiovascular system. This is my agenda for this presentation. First and foremost, we begin with the introduction of the heart, then heart anatomy, heart histology, heart physiology, and the related heart disease and treatment. So, what is heart? The heart is the most important organ of the circulatory system which help deliver blood to the body. Its weight varies from 218 to 314 gram, which is average 300 gram in males, and from 213 to 218 gram, which is average 215 gram in females. And generally, adult weight is achieved between the age 17 and 20 years. The heart is hollow, fibromuscular organ of the conical or pyramidal form with a base, apex and series of surface and borders. Enclosed in pericardium, it occupies the middle mediastinum between the lung and their pleural covering. This is additional information which is the location of heart based on the surface marking, which is we already label it with A, B, C and D, which is A at the right third costal cartilage by the side of the right sternal margin, and label B, left second intercostal space by the side of the left sternal margin, and the label C at the right sixth costal cartilage, and the last label, which is D, the left fifth intercostal space just medial to the mid-clavicular line. The next agenda is anatomy of the heart. We move to the border of heart first. Okay, basically heart have a six border, which is first is left surface of the heart. This surface consists almost entire of the left ventricle, convex and widest above, where it is crossed by the anterioventricular groove. It narrow to the cardiac apex. And second, which is right surface of the heart. This surface is rounded and formed by the right atrial wall. And the third one is the upper border. The upper border of the heart basically is atrial and mainly which is the left atrium. And the fourth one is the right border of the heart corresponding to the right atrium. And then the fifth is inferior border of the heart, which is it extends from the lower limit of the right border to the apex. It is formed mainly by the right ventricle with a small contribution from the left ventricle near the apex. And then the sixth one is the left border of the heart, also known as a obtuse margin. The left border separates the sternocostal and the left surface. It is round and mainly formed by the left ventricle, but to a slightly extent superiorly, it formed by the auricle of the left atrium. And then what about inside the heart? Basically, the heart consists of two types of chamber, which is the upper chamber is atria and the lower chamber is ventricle. So basically we have right atrium and right atrium, and then right ventricle and the left ventricle. So atria of the heart are the receiving chamber of the heart. Each atrium has protruding auricle, pectinate muscle mark atrial wall, and blood will enter the right atria from the superior and inferior vena cava and coronary sinus. And for the left atria, blood enter from the pulmonary vein. And then the ventricle heart are discharging of the heart, discharging chamber of the heart, which is containing papillary muscle and trabeculae cana, which is muscle mark ventricle wall. Right ventricle will pump the blood into the pulmonary trunk, and then the left ventricle will pump the blood into the aorta. The last one is coronary artery. The heart is supplied by two coronary arteries, which is right coronary artery and left coronary artery. Anatomically, the coronary artery are not an arteries. They are anastomosis by their trunk, branches and sub-branches at the precapillary level. Firstly, we move to the right coronary artery. It is arise from the right aortic sinus of the ascending aorta. So the course of right coronary artery, the artery passes forward to the right between the pulmonary trunk and the right auricle. It then passes downward to the right along the path of the atrioventricular groove. It winds around the inferior border of the heart and passes along the posterior part of the atrioventricular groove and reach the crux of the heart. In 16% of the people, the right coronary artery anastomosed with the circumflex branches of the left coronary artery. Branches of right coronary artery. Basically, the branch are divided into two groups, which is the first segment of the artery from the origin to the inferior border, and the second one is the second segment of the artery, which is from the inferior border to the crux of the heart, which is branches from the first segment. And then what about the left coronary artery? Basically, left coronary artery arises from the left posterior aortic sinus of the ascending aorta, which is wider than right coronary artery course. The trunk of the artery passes behind the pulmonary trunk and left the auricle. It divides into two branches, which is anterior interventricular artery and circumflex branch. So we move to the histology of the heart. Basically, I will talk about the cardiac layer. So basically, layer of heart we have a three, which is endocardium, myocardium, and epicardium. So endocardium is a innermost portion of simple squamous epithelium, which is endothelium, contain of smooth muscle and connective tissue, which is at the middle layer. Endocardium is mix of connective tissue and the smooth muscle. Subendocardial layer, which is the outer layer of the endocardium, is loose, and connective tissue is joining the endocardium and the myocardium. And then we have myocardium. Myocardium is the middle layer of the heart, which is between the endocardium and the epicardium. The articles contain the cardiomyocyte and blood vessel. This is one of the muscular layer. And then we have the epicardium. Epicardium is the outer layer of the heart, contain the blood vessel and lymphatic. They contain a visceral layer of pericardium, is rather thin. So we move to the physiology of the heart, which is cardiac cycle. So cardiac cycle is an event that occurs from the beginning of one heartbeat to the beginning of the next. It consists of systole and diastole, which is systole refer to the heart contraction and diastole refer to the heart relaxation. There are two types of cardiac cycle, which is atrial cardiac cycle and ventricular cardiac cycle. And then in atrial cardiac cycle, there are four events occur, which is first is atria passively fill, end of diastole, and the second is atria isovolume ventrically contract, which is start to systole, and the third is atria eject blood into ventricle, end of systole, and then the last one is atria relax, start of diastole. And same as ventricular cardiac cycle, but firstly occur in ventricular cardiac cycle is ventricle passively fill the atria, as atria fill and contract, which is the end of diastole, and then the same step as above occur. Then phase in cardiac cycle, which is the phase one is ventricular filling. Blood that will driven by the pressure in vein or venous return enter the atria and causing the atria to relax. Since when the atria contract, more blood will enter the ventricle and atria will diastole and ventricular systole will begin. And then we move to the phase 2, which is isovolumetric contraction. Ventricle start to contract, which is systole, and then at this time ventricular pressure will more than atrial pressure, causing the AV valve to close. And semilunar valve are closed because the ventricular pressure are less than pulmonary plus aortic pressure. So no blood flowing in during the isovolumetric. Then during the phase 3, which is ventricular ejection, ventricle continue contracting, which is ventricular pressure now more than aortic pressure, and then ventricular will eject the blood. And then lastly at the phase 4, which is isovolumetric relaxation, eventually now the ventricular pressure is lower than aortic pressure, causing the semilunar valve to close, and then the ventricle will start to diastole. All the valves now are closed, so some blood is still in ventricle as they relax, and then ventricular pressure will less than arterial pressure, so every valve will open and ventricular will now passively with the blood until they contract again. And then the last agenda is disease and treatment. So I will talk about the coronary heart disease. Coronary heart disease is the term that describes that what happens when your heart blood supply is blocked or interrupted by a building up of fatty substance in the coronary arteries. The plaque may rupture, spilling the cholesterol into an artery and potentially leading to the clot that stop the blood flow. So this will lead to the most death cause in Malaysia, which is heart attack. Angioplasty. Angio means blood vessel and plasty means opening up. It is common treatment for the coronary heart disease and heart attack. We know that in the coronary heart disease, plaque will build up in the wall of the artery and narrow down, thus the blocking of the vessel. So the angioplasty will help to remove the plaque. So how it is performed? There are generally 4 steps, which is first one, during the standard angioplasty, the doctor make an incision in the groin or wrist and insert the tube or catheter into an artery. Next, they treat the catheter upward and into the affected blood vessel around the heart. And the third one, usually the catheter contains an inflatable balloon that displaces the plaque or clot, effectively opening up the artery. And lastly, doctor will use the live X-ray and the contrast dye to guide the catheter and assess the arteries they need to treat. I think that's all I can share from my presentation. Thank you so much for listening.